So I'm curious from your perspective, what is the best way for, because I would imagine a lot of physicians, especially if they go into academia, they think, oh, well, the referral base is built in and, I don't have to do much, people will know who I am. I guess, how have you been able to, get those referrals, build that referral network for your program?
I would say three factors in order of importance. Number one, access. Access is everything, and I'll go into that in just a bit. Number two is communication. And number three is providing excellent quality care. Now, you would think that that last factor would be the most important. It's actually the least important. Number one is access. And by that, I mean that referrals are going to go the path of least resistance. So you could be the world's best surgeon, but if it's impossible to get to you, meaning it's some central scheduling, they answer the phone, your next appointment's in 6 months, what have you, people are not going to refer patients to you, even though you're the world's best surgeon. They don't care. Access literally is everything. If you make it easy for patients to see you and easy for doctors to send you patients, you will be busy off the bat, just that alone. Number two is communication. If you are available and you communicate via, and not by fax in this day and age is completely irrelevant. They should just ban faxes. But if you can email, text, phone calls, and be in touch with doctors, it makes you human and it makes you accessible. And that's going to also build your practice because you're going to have better patient care and you close the loop and there's continuity of care. And then the last thing is how good you are as a surgeon and providing excellent quality care. So if you're in academia, for the most part, those are well vetted out surgeons. There is quality assurance. So for the most part, those are going to be high quality surgeons. Now you just got to attack the other two things. Now you just got to work on access and your communication. And then when you have all three, that's when you can really dominate.
That's awesome. I think that's a great point about availability. I mean, I think probably maybe some surgeons or some physicians in general just let their ego get the better of them a little bit in that regard and think, oh, well, they should talk to my secretary or they should, talk to my office or whatever. And I think that's a good point you make about, especially when you're dealing, peer to peer, physician to physician, making yourself available. I was talking with one of the IR faculty about this, and he was telling me about a recent graduate of ours who went out and, he gave his cell phone out to all the hospitalists and the ER docs and said, when these different types of, people with vertebral compression fractures, that would need benefit from a kyphoplasty or something like that, give me a call directly on my cell phone. And he built a service line that way. And I think, what you're saying is so true from what I've heard from others as well.
Yeah, you absolutely have to put the work in. And it's like everything else. You got to put the work in. If you build barriers around yourself because you don't want your phone ringing, you don't want to get emails, you want to have a cush lifestyle and put these barriers around you, your practice will never be what it could be. So you got to put in the work. You got to put in the sacrifice. You have to be available. And yeah, sometimes you get a text or a phone call and you don't feel like answering that phone. I'll tell you, it's 100% happens. But at the end of the day, you got to answer that phone because you only have one chance to say no. The moment you tell someone no, or you don't answer your phone, you've lost that referral base. They're going to go elsewhere. And so you always have to have the perspective of put yourself in the shoes of the referring doctor. Think to yourself, if you were that referring doctor, what would you want? You would want the ability to send patients at a moment's notice to a specialist who's going to take good care of their patients and let you know how they're doing. So if you can provide access, communication, and high quality care, then it's game over.
That's awesome. One thing I've noticed that from I think one of the speeches you gave on YouTube that I watched it, you came to Miami to build a practice or to build the brain tumor center there. And I remember you talking something about building, not just within your own institution, but a referral network kind of within the region. I'm curious, how were you able to do that both probably in the Miami area? And then I'm sure you've reached out even beyond that and kind of, South Florida and beyond.
It's a grassroots effort, right? So I think that whenever someone is looking to build a practice, build a program, build a reputation locally, nationally, internationally, it sounds very daunting and it is a lot of work. My recommendation would be it starts grassroots. It starts locally. It's with those three things I said: access, communication, high quality care. Your patients will end up being your biggest referral source. And those doctors who are incredibly pleased with your care will tell other doctors. So what we've done here at Miami is we started promoting locally, meaning giving talks at every single hospital locally. But then once you hit a critical mass in terms of your referral base, your patients become your biggest referral source. And never lose sight of that, is that in this day and age with social media, everyone knows someone who had neurosurgery. So your patients, if they are happy with the care they got and the doctor's happy with the care you gave, they will tell everyone, hey, I had this surgery with so-and-so, and their friends will know, and they'll go talk about you. So that starts locally. It eventually starts to grow into a statewide reputation, then national, and then international. So there's no secret to it other than hard work, dedication, sacrifice, staying focused, and you got to provide excellent patient care. And that goes in a stepwise fashion, and it grows.